Good morning, my name is Omotola Taiwo and I will be performing a physical examination of my patient, Mr. Daniel. I would introduce myself, which I've already did to the patient, and I will close the door and perform hand hygiene and put on a glove. So to start with, I'll be examining the head and the neck, and that is starting with the periauricular sinuses in front. I'll palpate the lymph nodes, starting off with the periauricular lymph nodes in the front of the hair, the postauricular at the back of the hair, the occipital lymph node at the back of the head, the tonsillar lymph nodes at the edge of the jaw, the submandibular lymph node at, under the jaw, the submental lymph node under the chin, this anterior cervical lymph node in front of the neck, the posterior cervical lymph node at the back of the neck, the supraclavicular lymph node above the clavicle. Both, there is no enlargement and both are equal bilaterally. Then I'll go ahead and assess the cranial nerve 5, which is the trigeminal nerve, which has a motor and a sensory function. To assess the motor function, I'll ask my patient to clench his jaw while I feel for the masseter muscle strength, which is normal. The cranial nerve 5 is normal, is intact. Then I'll go ahead and assess for the motor function of the cranial nerve 5, which is the trigeminal nerve, by asking my patient to close his eyes, and I'll give a soft touch on bilateral side on each area of the face, starting with the forehead, the cheek, the chin, and the nose. Did you feel it bilaterally?
Yes.
All right. So the cranial nerve 5 is intact. I'll go ahead and assess the cranial nerve 7, which is the facial nerve, by asking my patient to smile, frown, raise your eyebrow, all right, puff your cheek, and put your lips. So cranial nerve 7 is intact. Then I will go ahead and assess the, can you stand up please? All right. I'll go ahead and assess the auditory canal and tympanic membrane using my otoscope in both here bilaterally. So using the lights from the otoscope, I'll pull my patient hair up and out, and I would examine the tympanic membrane and the auditory canal. God knows. Okay. On both here, up and out. So the auditory canal is clear with no swelling or drainage seen. The tympanic membrane is palely gray with no effusion bilaterally. Then I'll go ahead and assess the acoustic nerve, which is cranial nerve 8, by performing the whisper test. I'll cover my patient's hair, the one I'm not examining, and then whisper 3 words to the patient and ask the patient to repeat after me.
Christmas. 6.
Holiday.
Holiday. Mom. 6. 8.
All right. Hearing is intact bilaterally. Then I'll go ahead. Hearing is intact bilaterally. Then I will go ahead and assess the eyes. First, I will start with the peripheral and the central vision. Staying at the high level with my patient. I'll ask my patient to let me know when they see my fingers, starting from the sides. Did you see?
Yeah.
From above?
I see.
From below?
I see.
The peripheral vision is intact and central vision is intact. I'll go ahead and assess the pupillary reaction using my ophthalmoscope, sorry. All right, with the light on, I will ask my patient to look at my nose while I pull my light source from outside to inside to check for pupillary reaction. Okay. The pupils are 2 to 3 millimeters in diameter and they are responsive to light. So I'll go ahead and assess the fundoscopy and perform the fundoscopy exam, which is the fundoscopy exam, which is checking for blood vessels of the eyes. So I will guide myself in with my hands on the shoulder of my patient while I go in to check for blood vessels. And I'll perform this bilaterally. There is no, the disc margin is round and equal. There is no AV nick, no hemorrhage or drainage seen. So I'll go ahead also and assess the nose and the nasal turbinates.
H.
Shit, I forgot. That's the 8. This 3, 4, 5. So sorry, before I go ahead to the nose, I will have to examine the cranial nerve 3, 4, and 6, which the oculomotor, the trachea, and then the abducens. I'm using the H pattern. I'll ask the patient to follow the light with his eyes only. That is the extraocular movement. So the cranial nerve 3, 4, and 6 are intact. Then I will go ahead and assess the nose using a light source. I'll lift the tip of the nose up. The nasal turbinates are clear. There is no bleeding, no drainage. The septum is midline and is angling anteriorly. There is no septal deviation noted. So I'll go ahead and examine the frontal sinuses and the maxillary sinuses for tenderness. So the sinus, do you feel any tenderness?
No.
The frontal sinus, the maxillary sinuses, do you feel any tenderness?
No.
All right, there is no tenderness felt. So I'll go ahead and assess the mouth and the throat. So starting with the mouth, I will assess the lips. The lips is moist and pink. Then using my light source, I'll ask my patient to open his mouth. Open your mouth, please. The teeth is, there is no decay or crack seen. The gums, there is no bleeding, no lesion seen, is pink and moist. The buccal mucosa is pink and moist. The tongue is pink and moist and smooth. Please, the anterior pharynx is pink and moist. Please lift up your tongue. The floor of the tongue, of the mouth, is pink and moist with no lesions or drainage. And then I would have to examine for cranial nerve 9 and 10, which is the glossopharyngeal nerves, cranial nerve 9. It's the gag reflex, and I will not examine it for this examination. But for cranial nerve 10, which is the vagus nerve, I'll ask my patient to say, ah. The uvula rises symmetrically with phonation, which is intact. So cranial nerve 10, vagus nerve is intact. Then I'll go ahead and assess cranial nerve 12, by asking my patients to stick his tongue out and move it from side to side. So cranial nerve 12 is intact. So I will go ahead and assess cranial nerve 12, cranial nerve 11, which is the spinal accessory, by asking my patients to shrug his shoulders against resistance. All right, so cranial nerve 11 is intact. Am I done with that?
Wait, did we do?
I think I missed something.
Did we do the trachea? Yeah, you didn't do the thyroid.
We did the thyroid gland.
All right. Okay. Moving from the mouth, I'm supposed to like perform the trachea, the assessment of the trachea. So I'll palpate. The trachea is midline. Then I'll go ahead and examine the thyroid gland, putting my hand in the cricoid process and the suprasternal notch. I will place my fingers on the notch and tell my patient to swallow while I retract my hand. Please swallow. Feeling for nodules and sides. There's no nodule and side. There's no nodules felt. Am I right? Okay. The upper extremities, right? So I'll go ahead and
Do you do
the spinal?
the bell, the stethoscope?
Oh goodness.
Maybe we should record the one for your TikTok on a different day, like tomorrow.
Okay. So I'll do this one, right?